Welcome, everyone. Very excited to present today on how to operationalize AI at the edge to transform proactive healthcare. My name is Daniil Krets. I'm with Esper. I'm joined by my co-host, Erika, and she's with our partner company called Stratix. So I'll let her introduce herself real quick and move on to the next slide, and we'll dive right in.
I'll step out here because I'm a little shorter, so behind the screen. My name is Erika Haynes. I'm a healthcare sales associate with Stratix. My background is clinical by nature, so I'm a registered nurse. I've been a nurse for over 20 years, recently transitioned over to Stratix. So just a little bit about Stratix. We're a mobile logistics company. We've been in business for over 40 years and collectively have over 30 partners that we partner with, and so Esper is one of those. And so I'm excited to be with Daniil to carry on the conversation.
And a little bit about myself and Esper. I'm a senior director of partnerships at Esper. We are a mobile device management company. So we help a lot of companies out here presented on the floor like Care.ai, Doximity, QGenda, to run their devices in the field in healthcare settings. We do a lot of work in healthcare space and work with Android, iOS, iPadOS hardware and help a lot of companies to bring their solutions to the market in healthcare space. I'll start with a statement on AI. We're at the AI Pavilion. Everyone had a lot of conversations about AI this week, most likely. But the potential of AI is limitless. There's a but though, right? And execution is harder and more expensive than you thought. Right? We're seeing a lot of that with our customers, and we'll share a few examples and lessons learned from deploying solutions that work on AI and run on devices in the field at the edge. To clarify, edge use case is essentially your hardware, your tablets, your phones, any other form factors, running some apps in the field, collecting some patient data, or delivering your healthcare solutions to the market. Here's what we're seeing. AI shifts to the edge, right? So as I just walked you through, we're seeing AI running autonomously on the devices out there in the field. There's more and more solutions and companies trying to integrate AI into their apps that are running in the field, which means that there is device management involved, right? The devices need to be locked down. They need to be secure. The devices are processing patient data. So there's a lot of process involved when it comes to deployment, management, and support of the hardware in the field that companies need to think about and operationalize, especially as AI models are starting to run on the devices in the field. Like I mentioned, operationalizing edge AI is very important. I'll speak to some benefits and some important points as to why companies care about running AI on in the field on the devices. First of all, reducing latency and improving responsiveness, right? There's a lot of situations in healthcare settings where 1 second really matters. And when AI model is running at the edge on the device in the field, that improves the responsiveness of your solutions. Local data processing is another one. We all know about the poor or intermittent connectivity in healthcare settings, right? So that solves for that particular issue. Faster innovation cycles, small AI models running somewhere in the field means faster feedback loops, faster feedback, and innovation that companies can bring to the market. And last but not least, cost savings, right? The devices running the models locally at the edge don't have to talk to the cloud consistently, right? And that reduces costs because obviously cloud solutions cost a lot of money to software companies and hospitals that are trying to deploy those solutions in the field. We'll move on to the next slide and share some stories. Admittedly, we're still early days. There's still early days for us too. But we are in a unique position, seeing many use cases every week, both at Esper and Stratix, of companies trying to deploy solutions and integrating AI into their apps and software running in the field. We'll share some lessons learned. Hopefully they will be useful. We're not going to be talking specifically about what customers and their names we're talking about, right? But you're welcome to go to esper.io or stratix.com take a look at our websites. We have case studies and additional information. So if you're looking for additional details, they're available. And you can always ask some clarifying questions in the QA that we're going to wrap up with. So I'll start with the first one. Delivering AI-powered proactive care, right? So this is one of our remote patient monitoring customers. They deploy Android devices in the field to capture some data and run their remote patient monitoring solutions. They help hospital systems to bring that to the market together. A couple of things that I wanted to highlight. So first of all, the company we're working with has a big engineering team. They looked at different OS types. They considered Linux for their devices. They considered Android. Ultimately, what they realized before they made decision to build the solution themselves is ultimately software is their product, right? So they don't want to waste resources of their engineering teams managing the devices and the infrastructure. And realizing what you're really good at when it comes to deploying these solutions is very key. That's what they did at the early stages. And they outsourced the device management and infrastructure management so that their engineering resources are focused on their software. Another lesson learned is security comes from deep ownership, right? Esper is installed as a device owner on Android hardware. So Esper helps essentially give you access to additional layer of hardware and software settings so you have more control over the hardware in the field. You can lock down the hardware, make sure that all of the apps are running properly. As a software company, this particular customer cares about deploying the latest versions of their software to the field. So we enable that and help with that. They have extra layers of security to make sure their devices are up and running because the devices are their business. That's how they essentially do business in the field and bring those solutions to the market. Last but not least, customer experience matters. So some of the things that we discovered connecting with this particular customer is they want to make sure that their end users don't even understand that AI is running on the devices, right? So they want their customers and end users to be as comfortable with the devices as they are with any home appliance, right? So that customer experience really matters when you're deploying software solutions in the field. And that's something that companies that are vendors in the space deploying solutions on the hardware or hospital systems have to think about. I'll pass it over to Erika to talk about another use case, particularly with Stratix, and let her dive in.
All right, so he's talked a little bit about the technical aspects of things. So with my background being a little bit clinical, I'll kind of dive into one of the use cases that we ran into. And so from my perspective, as being in the clinical field, I'm on the patient care side of things when I'm in my nursing role. Now, back up and go into the sales role, and then I need to be an advocate for those clinicians to help deliver a vehicle that is useful to them, which it creates a little bit more efficiency for them, allows them to cover a wider patient base, as well as increase patient outcomes. So successful deployment of tech and non-tech solutions, right? It's not kind of a one-size-fits-all. And so one of the key components of that is preparation, right? You can't move forward with the solution if you don't have the preparation and figure out what are the means behind that. So part of that, when you're thinking about a workflow that relies on AI, for example, I'll talk about a use case that we have that with one of our customers that had a AI solution for wound care, advanced. They went to go deploy that out into the field. And when deploying that out into the field, they ran into some barriers, right? Like it got into the hands of the clinicians and then they ran into some problems. Part of the reason behind that was because they hadn't thought of a more holistic approach behind that. So it's really important to think forward thinking and strategies and partnerships. So I always joke, my colleague, Ian Fogg, who's the director of healthcare at Stratix, he's more technical and I'm clinical. So I'll handle some of the clinical questions and he'll handle more of the technical aspect of things. But we lean on one another to kind of have a better whole picture of what clinicians may be facing in the field and try to solve for a solution for that. So the reason that they weren't able to, they were running into issues is because it couldn't operate. They were using older devices and it couldn't, wasn't have the correct operational system behind it, right? So, having a partner like Esper and somebody that's more of I guess, an expert in that area, and that management is able to kind of provide those insights, and we can get them involved early with the customer on a technical discovery call and integrate those concerns and address those ahead of time so that they're forward thinking and they can address those questions moving forward when the implementation and the deployment process begins. So another touch point is we kind of touched on a little bit. Multi-use means shared resources, right? And so you wouldn't send your kid out to go do like their driver's license without the preparation that goes behind it. And so you're going to take so many hours to go through the educational process. You're going to go through so many hours, right, having them drive and stuff like that. These delivery methods are no different than that. You need to plan ahead. You need to have numerous people involved early and often to kind of help you with that end deployment. The last thing I think that's probably pretty important to note is that time is money. Time is patient care. Time is clinicians' time, right? And so in the whole scheme of looking at everything when you go to deploy, I wanted to kind of keep in the forefront of your mind is a lot of times these tablets and devices that are out in the field are out in the field with clinicians. They're going from home to home in the home healthcare space, for example, in a hospice. And so you have to take into consideration if you're going to have those clinicians come in to turn in those devices and then send out with a new device, or if it could be managed on the backside where it's seamless. You don't have to have the clinicians come in, do the swap, and it's literally a matter of seconds to minutes, and it decreases the downtime for clinicians, which also allows them to have a seamless workflow and not disrupt patient care on the backside of things. And I'll pass it back over to Daniil.
Thanks, Erika.
Sorry.
And last example, a couple of extra lessons learned here. The one I want to really highlight is probably lesson 3 here. Think about how to scale at the beginning, right? So we work with a lot of startups that push their solutions in healthcare settings on the market. And obviously they want to go to market as fast as possible. They have their MVP. They use some sort of hardware they did very little research on, and they're not thinking about how that solution is going to scale, right? So it's one thing to run some projects with some hospital systems, deploy a couple hundred devices in the field. A completely different situation would be managing thousands of devices in the field, right? So this is what companies like Stratix really help with, because obviously operationally you need to think about how are you going to get those, how are we going to take care of kitting and staging of all of the hardware, right? How are we going to package it up? How are we going to do reverse logistics of those devices, right? That's one big issue that a lot of startups are running into. One thing I wanted to really highlight is the hardware that you started with is not necessarily going to be something that you will deploy when you're past that MVP stage, right? So it takes a lot of work, and hardware software compatibility is something that we have deep expertise in. And a lot of companies, it takes them years to figure out, right? So it's really important to find the right partners when it comes to hardware, software infrastructure, operations like Stratix, to really make sure that the operations are running smoothly. You're able to deploy your solutions to the field in a timely manner, devices are secure, and you're able to take full control of the process by leveraging those partnerships. Let's move on to the next slide, where we'll summarize that it takes a village to deploy a solution, especially in healthcare setting. A couple of important components, like I said, hardware partners. You really need to make sure that you're working with someone you can rely on. You don't have crazy wait times to deliver your hardware. You have someone with technical expertise who's willing to fine-tune the hardware for your use case, and really work on that hardware-software compatibility so your software runs smoothly on the devices. Device infrastructure is important. Mobility solutions and services, again, highlighting Stratix and their expertise in that area. And then I highlighted customer experience on the edge multiple times and want to highlight again software and apps. This is really important because really that's what your end users, be it clinicians or folks in their homes recovering or home care solutions that are delivered at homes, they're really interacting with your software and it's your business, right? So it's important that you work with the right partners to deliver hardware and operations, but also have the resources to focus on the software. With that, thank you so much for listening. Really appreciate it. Again, Erika is with Stratix. You can check out their services, and they work with a lot of healthcare companies in the space and help them really get their hardware to the market and make sure they have smooth operations. And again, we're with Esper. We're device management software solutions, and we help to run those devices. We're really on the back end of the hardware. Most end users don't know we are running on the device, but we help secure them and push updates and manage the full life cycle of the hardware. We have 4 minutes left, so if there's any questions, we're happy to answer them. Anyone? Looks like we did super well. All right. Well, thank you guys so much for coming and listening to our presentation. Hopefully, you learned something. Again, you can reach out to Erika and I, or just go to our website, learn a little bit more about the solutions and what we've helped deploy in the field. Thank you.